So we're going to talk about facial myokymia. And myokymia means the muscle is twitching. However, there's a lot of confusion over the nomenclature for these various types of twitching, which is the muscle firing involuntarily, and they're not all myokymia, even though they're all called myokymia. So in ophthalmology, you're familiar with superior oblique myokymia, which is when the superior oblique fires by itself. That causes a monocular shimmering effect. And because the superior oblique is an intorting muscle, it causes the intorsion like this, and they get diplopia. But it's monocular. It's actually a micro tremor, not really a myokymia, but we call it superior oblique myokymia. We do image this, even though it's almost always idiopathic. You've got spasm or twitching of your eyelids. And if it's just this part of your lid, I have this. We call that lid myokymia. Stress, caffeine, lack of sleep causes it. We don't image that. So it's just one muscle in one lid. That is called lid myokymia, but it's benign. We don't have to scan that. You've got the spasm of both lids, and that looks like this. That's called blepharospasm. It's bilateral, and it's usually essential, which means it's benign. Benign essential blepharospasm. Bilateral, simultaneous firing of the lids. If it goes in your face, we call it the Mej syndrome, so it's in the face. And if it's just one half of your face, we call it hemifacial spasm, because it's only half. It looks like this. So half a face. We scan this, MRI. Rarely it's a tumor or an aberrant artery in the vertebrobasilar system, dolichoectasia. Don't have to image the benign essential blepharospasm. However, facial myokymia, you do have to image. So facial myokymia is, instead of the lid twitching, it's in your face, and it looks like a worm is crawling underneath their skin because we have an asynchronous firing of the muscle fibers, and it's so we got this worm under your face in the facial nerve distribution, facial myokymia, image that. Hemifacial spasm, half your face, but the whole side is moving, image that. Benign essential blepharospasm, bilateral and lid only, you don't have to image that. Mej syndrome, it's your eyelids plus your face, but bilateral, synchronous, you don't have to image that. Lid myokymia, only one muscle under your lid, you don't have to image that. They're all twitches and spasms, but some are more dangerous than others.